Okay, hello everyone. Thank you for joining us and welcome to our live panel with RMR Laboratories. We're here today to talk about our transdermal CBD pain relief product. My name is Leila Fenelon and I've been leading consumer research for RMR, and today I'm going to be moderating our discussion. So we're hosting this 30-minute Q&A to answer any questions that you may have, but also so that you can hear directly from people who have been using our product. And as an added bonus, we are unveiling a little surprise towards the end of this, so stay tuned. So a little about me. I've been doing product innovation and consumer insights in the natural space for about 10 years now, running focus groups, ethnographies, and home usage tests. And as I went through the product trials with our users, I was blown away by the feedback that we were receiving. It's rare to get universal consensus about a product. And in this case, everyone we spoke to who had used the product reported that it helped relieve their pain, and then it worked within minutes. And that's just really great validation about what we're trying to accomplish here, which is to provide safe and effective pain relief for all, and to really help people who have surrendered and resigned to their pain. And so we wanted to share that feedback with this broader audience and to just have an open conversation, address any questions you may have about the product or the company. So we've assembled this wonderful panel. We have two of our product users here, Callie and Armand. Thank you for joining us today. And we also have our CEO, Mike.
Hi, guys.
So before we dive into the questions, I'm going to have the panel introduce themselves so you know who you're talking to today. Let's start with you, Callie.
Hello, I'm Callie. I am a voice actor and a fitness instructor. And 3 years ago, almost exactly actually, I fractured my spine and have kind of been dealing with that ever since. And yeah, so that's kind of what got me really interested in this product. I've heard a lot of great things about CBD and have never really had any experience with it, so I wanted to try it.
Great, thank you. And Armand?
Hi, my name is Armand, and I am a creative director, designer. And I, grew up playing sports. Now I do daily weightlifting. So I was interested in this product just because doing these numerous activities for years takes its toll on your body. And I wanted to experience a product that could relieve pain quickly and effectively. So I think we're on the right track with this product.
Great, thank you. And Mike?
Hi, I just want to just say a quick hello to everybody that's joining. Thank you so much. I hope this is the first in a series of open conversation that we're going to have with you and with the broader community beyond. We wanted to try something a little bit different in RMR Laboratories. And again, open up and get you stories directly from our users. And so again, I'm looking forward to a great discussion. Thank you for joining. And yeah, let's get to it. I'm excited. Thank you.
Great. Great. So before we open it up to the audience, and we will be tracking your questions along the way, Callie, Armand, when you were first approached about this product trial, can you tell us your initial thoughts? Did you have any expectations for the product?
I didn't have any expectations. I was very interested in more because it was a CMD type of ingredient, I should say, because I'm very unfamiliar with that. But I do like that it's a homeopathic type of pain reliever. And that's something that I gravitate toward. Especially, I don't really take anything past an aspirin, so I kind of gravitate toward things that are more pure and natural.
Got it. Yeah. So yes, it is a natural alternative to a lot of the products on the market right now. Okay, makes sense. And Callie?
I would echo that. I also feel weird when I take any kind of, and especially following a spinal injury, they really wanted me to be on intense pain prescription pills for a long time. And I felt horrible within a few days. And so, that was more of an acute stage, but moving forward, just with, a few days in a row or something like that of dealing with pain, I would kind of come up with my own little weird remedies. And so I'd always been interested in CBD because I'd heard great things from the few people I knew who had been lucky enough to use that or try it. So I think my expectation was, I hope this works.
That's great.
Yeah, and one thing I'd like to add is one thing that this product could have many advantages compared to other products, especially drugs, is that there's less side effects or no side effects, which is something that's really important to me and hopefully to other people. I mean, the less side effects that you have to worry about, I think that you can just rely on how effective the product is.
Right. So let's talk about that a little bit. Can you tell us about your experience with some other pain relievers that may have had side effects, or just how did you tackle pain before this?
You really, besides the pain relievers that are out there that are on the market, the Motrins and the Aleve, it has naproxen. I mean, there are some side effects with that, everything from thinning your blood, because you could have some reactions to that. I didn't want to become too dependent on that type of drug, even though they are quick pain relievers.
Right, understood. I'm just going to pause for a moment. So for our audience, you can submit your questions using the Q&A option. So feel free to use that if you have questions along the way. Okay, great. And so now let's talk about this product trial, and let's start with, how did you guys use this product? Can you walk us through that?
Yeah, so I kind of already have a little system in place if I'm dealing with back pain or muscle pain from, like you said, sometimes training physically is very wearing on your body, and so you have all sorts of aches in weird places. And so I deal with that already using anti-inflammatory foods, and I use like a essential oil mixed in with a moisturizer thing that's kind of like a muscle rub, basically. And so I added this to that. And usually I just saved it for days where I was experiencing pain, which I left out. The trial happened to be during a lecture that I was in, and whenever I sit for more than an hour, I'm usually in pain for the rest of the day. So
that's terrible, but it's good time for us.
Yeah, exactly. So I had a great practice application, and I did. I felt like I noticed a big difference using that on top of my existing kind of routine that I go through.
That's great. And Armand?
So I only use the product once a day, and I did use it, even though I work out in the morning, I did use it before I went to bed. And the reason why I used that at that time is because I wanted to be more in a rest position. And then also too, because one of the areas was my neck, and there's nothing more important than getting a good night's sleep. And I can tell you that since I had this chronic pain in my neck, I wanted to make sure I was able to sleep a little bit more, how do I say, easier than it was without it.
Right.
So that's important.
Good. I'm glad we're helping. So then let's take a step back and think about, when you were applying this product, and just, I'd love for you if you could walk us through your experience after you apply the product. So what did you feel? What were some of the effects that you experienced?
For me, I felt like, when you're in pain, and it doesn't have to be excruciating, it could be a 5. It's distracting. You are trying to focus on other things, your work, whatever it is, and it's just hard to, going to sleep. It's hard to do those things, even if you're at a medium level. And so for me, what I would notice is I would apply it, I would, continue going throughout my day, and then kind of realize at some point, like, oh, I don't think I've thought about being, my back in like 30 minutes. This is cool. So that's the easiest way I would describe it. I wasn't super meticulous about like, how long has it been? I would just realize that I wasn't distracted and more focused.
Right. And that makes a lot of sense. And we heard that a lot where people's pain, it's a distraction. It interrupts your day. It doesn't let you be yourself or get things done. So I'm happy to hear that it sounds like it freed you up to just go about your business.
Yeah, absolutely.
Great.
Yeah, I think that's important too. I think you're allowed to focus on other things instead of the pain that you are experiencing, whether it's your back, your shoulder, or your neck. It allows you to move more freely. It allows you to focus, whether it's work, whatever you're doing for relaxation. I think the ability to move freely is important.
Got it. Great. And so on this note, we have a question from Chris. So when you applied the product, can you talk a little bit about what the touch, feel, smell, so like some of the sensorial pieces were?
No, I like that. That's important. I would say not a very strong smell. I did apply it over, for me, something that had essential oil in it. So I feel like it probably picked some of that up and smelled more yummy. But it's very smooth texture. It's kind of thick. It's kind of a thick cream, so a little bit goes a really long way, which I was impressed by. I think the trial period we initially did was 3 days, and mine lasted way longer than that. And I'm using it on my back, which is not a tiny area. So yeah.
Yeah, this product, I find it very concentrated, which is nice. So you don't have to use a lot. And I like the fragrance. I think since I've worked in skincare for many years, I kind of gravitate toward fragrance-free products just because it's better for you. But it did have a nice, natural, essential oil type of fragrance, which I like. You do need something to at least make it look like it's warm and inviting. I did find, again, I found it very concentrated, and I felt like within 5 or 10 minutes, it relieved, whether it's 60 or 70% of the pain, you know that it's working fast, which I think is important.
Right, great. And I'd like to speak to that a little bit because I've been, a little involved in the product development. So we, some of the complaints we've heard along the way about product topicals that are currently on the market is they have a very strong smell, and we basically didn't want that. We want people to be able to use the product and go to work and not reek. So in terms of fragrance, we were trying to get something a little muted and neutral. And then in terms of consistency, as they mentioned, something that's easy to rub on and spread to the areas that are affected. Thank you for that question. So let's talk a little specifics now. So Armand, you've been talking a little bit about sleep and how it helped you sleep. And when we first talked to you when you tried the product, you basically talked about the issues you had with your neck when you were sleeping or even watching TV, and how you had to kind of customize your pod. Can you tell us a little bit more about that?
So I can tell you that when I did have the harsh chronic pain in my neck, I would purposely go to bed earlier so that I wouldn't lose, or I try to get my 7 hours of sleep, even though I was, going to bed earlier, like 2 hours before. And now that I've taken the product, since it relieved some of that pain, I find myself not having to adjust many times during the night or propping 2 pillows. So I think that's important to me now that I don't experience that much pain, and I can sleep a little bit better.
That sounds rough.
Yeah, it is. It was rough. It's rough because I believe that, especially if you're working out or training, sleeping, eating, and training they're all linked to each other. So if you don't sleep a solid 7 or 8 hours, it's the benefits are thrown away.
Right.
So I think that's the reason why I thought this product was great for that sharp pain in the neck.
That's great.
Yeah.
I'm glad you're helping you sleep better.
Yeah. And I think I think as most people, they don't want to. If you were to go to an orthopedic surgeon, they would probably recommend surgery immediately.
Right.
And that's something that I'm trying to get away from.
Right. That's great. Thank you.
Yeah.
And so, Callie, you touched on this a little bit, but with your lifestyle and all the physical activities, can you tell us a little bit more about before this product, it kind of interrupted your day. So can you tell us a little bit about that and how when we did talk to you about the trial, you said you just kind of forgot about it. So
yeah, well, actually, you're kind of reminding me of a more recent experience. I just, from my training, I'm not really sure what's going on, but I've had a lot of hip flexor pain, which is fairly common, especially we all drive around all day, and so our hips are in flexion all the time, and it just causes tight hips. But lately, it's been interrupting my sleep a lot because they just hurt so much that I couldn't relax and fall asleep, and fidgeting and trying to find the position. And okay, if I put one pillow here and one here, maybe no. And yeah, just from using that on top of my system I already have figured out, it's enough to kind of be like, okay, I can go to sleep now. Like this isn't so distracting that I can't think about anything else, including closing my eyes and falling asleep.
Right.
And so that's, I think, the chronic frustration of people who experience chronic pain is that you just can't relax, and there's like an underlying anxiety all the time because it sucks to have things hurt.
Right, and it's always there.
Yeah, and it was a tough adjustment for me too, because I think especially I fractured my spine when I was 27. So that's fairly young. I hadn't ever experienced getting out of bed and like hunched over and hobbling to the bed. Like I'd never gone through that before, and I felt like, oh my goodness, I feel like trapped in this body that doesn't make sense to me anymore. And so it was really great to have something combat that.
Right, that's great.
I don't know if that answers.
Yeah, no, it totally answers the question. And in this research and other research that I've done around pain, it's just I can't even imagine. It's so debilitating in many cases. And I think that the sad thing that I heard when I was doing pain research before this product is people just accept it, and they think that they have to live with it. And it's like this resignation. And so that's why I'm so excited to be a part of this, because I don't think you should be resigned to pain, and I think you should try to find ways that work for you. And the really great thing about this product is it sounds like it does help a wide range of different kinds of pain, which is exciting.
Yeah. And Leila, if I might just step in for a second. We have two questions from the audience related to supply chain, but also related to the technology itself. So I'll take those if that's okay. So Ethan asked, given the proliferation of suppliers to this industry, what kind of supply chain disruptions could be brought forth based on product quality, and how are we managing that at RMR Laboratories? Great question. And so, the short answer is that, we are in a position where we're able to kind of choose some preferred suppliers to work with, based on the quality of our technology and the strength of our current partnerships that we have, that not only with Advanced Nutrients, who is a big player in the cannabis space, but some other partnerships as well. What we're doing is we're engaging in discussions to develop long-term supply agreements with a few preferred suppliers, where we deem, that they have their operations that are stable, that are licensed, and that have all of the quality measures that meet our standards, which in some cases are over and above the standards that exist in the industry. And you'll see some of that shakeout going forward, I think, with the suppliers in the industry. So I think that's what you're getting at. But again, the short answer is that, we are in the process of developing long-term supply agreements. And I think that's the approach we'll take going forward to manage any supply chain disruptions or product quality issues. Then another question came from Mark, and he asked specifically about the technology itself. And Leila alluded to this, but let me just elaborate. many topicals stop at the surface. And I think that's part of the education that we have to kind of have, or part of the discussion that we have to have with our community of users, both current and future users, is that, the technology that we have actually drives the active ingredient below the skin, right? We've created a path where we take the intracellular route through the top of your skin, and it drives the active ingredients to the soft tissues below, where it really delivers it to the point in which you need it. Most topicals stop at the surface, and they rely on other ways to produce a perceived pain relieving effect. We mentioned some of that earlier in terms of menthol or other things like that. But our technology and the portfolio of IP that we have really is built around a delivery system that drives these active ingredients through your skin to the soft tissue below. So thank you, Mark and Ethan, for those questions. I'll let Leila have it.
Okay, great, yeah. And so thank you for all the great questions, and we're just we're catching up to look at a couple more. So we have a question from Dawn about how often would you have to apply it during the day to keep pain level manageable. And so just to intro this before we open it up to the panelists, with pain is very specific and different for different people. And so I think that it's going to be different for each case and each type of pain. But let's hear from our respondents of how often they needed to use it in their case.
You want to start?
Yeah, you can go.
Well, I'm going to tell a little kind of embarrassing story. But because I think it's a good example, because I agree that I think it varies, and I would have days that are pretty fine, and I would put it on once and be done with it. And then, like the story I'm about to tell, I would have days that were a little bit more acute. And in those situations, I would apply it more frequently. But I recently got my motorcycle license, and I've been learning how to ride a motorcycle. And one of the things that happens when you're learning how to ride a motorcycle is that you inevitably come to a stop or go slow, and you drop the bike. And so then you're faced with this dilemma, because there's like 500 pounds of metal on the ground, and you have to pick it up. And me being me, I didn't want to ask the mailman dropping off mail to help me. I was like, I'm gonna pick it up, and I watch these YouTube videos. And there's a special way to do it so you don't hurt your back. But needless to say, I did it the way it said, but I definitely still strained something a little bit. And the next day I was like, oh man, I messed up. Like, I was stupid. And so I definitely dived into my sample that I had. And in that situation where I was in a good amount of pain, I probably used it every 5 hours, maybe. Which I still feel is a pretty long time. And also worth mentioning that I didn't notice any residue on my clothes, which I thought was really great. I felt like it absorbs pretty fast if you rub it in vigorously. It's not like oily or weird, which has happened to me before and is frustrating. So.
And it's helpful to massage it in. I think it's
absolutely.
It's also relieving.
Yeah.
When I did this, I did not use the product no more than twice a day, but I did feel that once in the evening was manageable for me. So I think, once or twice, I can't see using this product no more than twice, just because it does what it does, and I don't know if I would even remember I have the time to do it 3 times a day.
Yeah.
But I do feel that once or twice is sufficient.
That's great.
And I like that.
So so this has been their experience, and again, it varies, but I think it depends on how acute the pain is. If you're picking up a motorbike, I don't even know how you did that.
Special way, I'll show you.
So yeah, I think it varies, but it sounds like it lasts a pretty good amount of time. So also, I think the usage amount, we also got a question about the usage amount, and as with most topicals, it really depends on the area, but it sounds from our panelists that a little bit goes a long way. They had a sample size that was about 20 milliliters, so less than an ounce, and it lasted them quite a while. So I think a little bit of product goes a long way.
And I'll just add on to that is that our first series of products, and we had a few questions on when this product will be available. So the plan right now, the operating plan, is to launch our chronic pain and our athletic pain relief creams in the first quarter of next year. So we're heading driving into 2018 with that plan. In terms of dosage, we're also controlling that based on the product form that we have. So our initial form is going to be a pump, and every pump administers about 1 cc worth of product. And as I think folks have mentioned, I think that goes a long way, and we thought that was a good dosage to start out with.
That's great. So we're nearing the end of our Q&A, and so I just wanted to say thank you so much for all your questions. We have noted them, and I'm sorry for those who still have lingering questions, but please feel free to email us or post to the republic.co discussion board on our page, and we're happy to answer all of your questions. But we do want to stop in time for our little surprise unveiling, and Mike is going to show you that.
Yeah, and so heading into the product launch next year, we've been hard at work, determining the brand and packaging concepts. And so I just wanted to, give the folks on this webinar a sneak preview that we have our packaging concepts now. And I'll bring it up and I'll flash it on the screen quickly for you guys.
Mm-hmm. Give us just 1 second. Okay. So we are going to be. Callie can see it. So we are going to share a screen. Give us 1 second.
Yep.
Sorry, just 1 moment as we do this.
Yeah.
Oh, the JPEG. Okay. Sorry about this, guys. We're just figuring this out real quick. Oh, here it is. Okay, Mike. I'm going to not letting me share the screen. I'm sorry about
All right,
this, guys.
and as sometimes happens, like I said, we're charting a new path here, and so we'll figure out the technical difficulties later. But we'll make sure to update the Republic page.
Can we look at it on the?
Yeah.
Is that possible? Just for like
I think it is possible.
Okay.
Let me see.
I think I have it too.
really
All right.
We'll also.
All right, we're keeping you guys in suspense. Let me.
We're also going to make sure to update the Republic page with the latest. Here it is.
You have it?
Yeah. Yeah, you have it.
Okay. Sorry, guys. This is really high tech. But if you can. Oh, actually, there we go. There we go. So, our product is going to be called Relevia. And if you have any feedback on that, please feel free to share. And yeah, as Mike said, we will be posting a high def image for you. This is just a sneak peek. Great. Well, thank you so much for joining us and for all your great questions. And please, let's keep the discussion open. You can post to our board or email us. Again, sorry if we weren't able to answer all the questions, but we're available anytime. So please keep talking to us. Thank you.
Thank you.
Thanks.
Bye.
Have a good day.